Refer to the medical record for the appropriate orders. Assemble your supplies, which include personal protective equipment, tracheostomy care kit, 0.9% normal saline, suction supplies, a pulse oximeter, stethoscope, a pen light, a drape or absorbent barrier, and extra sterile gloves. Make sure to identify your client and assess for any allergies. Explain the procedure and assess for questions and clarification if needed. Instruct the client on how to communicate their needs, or if they are in distress, by having a signal, if nonverbal, such as raising a hand. Raise the bed and bedside table to a comfortable working height. Position the patient and your table to maintain sterility. Assist the client in a supine or semi-Fowler's position. Their head may be slightly hyperextended. Perform needed assessments. Be sure to auscultate lung sounds, assess respiratory rate, obtain baseline blood pressure, baseline pulse oximetry reading, and baseline heart rate. Hyperoxygenate the client prior to and during the procedure. Be sure to look at your facility's equipment for indications on how exactly to hyperoxygenate with the equipment that you are provided. In this case, we are using the indicated instructions to increase from 30 to 35% oxygen delivery. Place a towel across the client's chest to help prevent bacteria and other organisms from transmitting onto the client's linen and bedding. Assemble your suction equipment appropriately and turn on the suction device. Be sure that the lid to the canister is on well. Connect the short suction tubing to the vacuum, and then the other end of the short tubing to the port indicated as vacuum on the top of your suction canister. Note that there is another port that states it's for the patient. This is where the end of your long suction tubing will go. Firmly attach it there, and then place the end of the suction tubing within easy reach of your patient and yourself. Make sure that all the other ports on the top of the canister are closed and that the lid is on secure. Turn on the suction and adjust via the dial when needed. Be sure to apply suction at 80 to 120 millimeters of mercury for adults, and this number should be measured when suction is being applied. Remove your gloves and perform hand hygiene. Assess expiration dates and open dates on equipment in solution. Pick up the container with the label facing your palm. Lip the fluids from the saline container into a trash receptacle if not using sterile saline from a kit. Open your suction and your tracheostomy kits following sterile procedure. Don your sterile gloves. While maintaining sterility, remove the sterile drape from the tracheostomy cleaning care kit and place it on the bedside table to the right of the kits. Remember, the shiny side is the absorbent barrier, so the shiny side needs to be down. Keep in mind that you have a 1-inch border that is non-sterile. Maintaining the sterility of the drape and the contents of the kits, use your sterile gloved hand to remove contents to the sterile field. Be sure to arrange items on the drape, starting with things that you will use first, closest to the client. Designate a dirty, non-dominant hand to pour approximately 100 milliliters of your sterile water or normal saline into the suction basins. If you are using water or saline from your kit, you will pour it at this time as well. In addition, you will pour approximately 1 inch of sterile solution into all 3 basins of the tracheostomy clean and care kit. Instruct the client you're about to suction the tracheostomy. Assess the pulse ox and heart rate. Pick up the suction catheter with your dominant hand and connect the suction tubing held in your non-dominant hand while maintaining sterility. Do not touch the green valve or suction tubing with your dominant hand. While grasping the suction catheter approximately 7 to 8 centimeters from the end with your sterile dominant hand, dip the tip of the catheter in the sterile suction basin and apply suction to ensure the equipment is working. Ask the client to take several deep breaths. At the end of a client inspiration, remove the oxygen device with your non-dominant hand and quickly but gently insert the catheter into the tracheostomy airway until resistance is met. Keep in mind that you are not to apply suction while inserting the catheter. When resistance is met, pull the catheter back 1 centimeter and intermittently apply suction by placing the thumb over the hole in the suction catheter while withdrawing and rotating the catheter for 10 to 15 seconds. Replace the oxygen device using your non-dominant hand in between each pass. You may pass the suction catheter up to 3 times, being mindful to replace the oxygen device with your non-dominant hand in between each pass. Remember to rinse the suction catheter before repeating the procedure. Once finished, you may disconnect the suction catheter with your non-dominant hand and place it out of the way. Again, using your non-dominant hand, remove the oxygen source, if in use, and unlock and remove the inner cannula, making sure only to touch the connector and not the cannula tube itself. Replace the oxygen with your non-dominant hand. Grasp the cleaning brush with your dominant hand from your sterile field and wet it in the largest basin. Dip the inner cannula also in the largest basin. Thoroughly cleanse the inside and outside of the inner cannula using the cleaning brush. Do not clean over the sterile field. Without going over the sterile field, dispose of the brush when you are done with it. Ensure that any droplets do not contaminate your sterile field. Rinse the inner cannula in the second basin of normal saline and remove any excess fluid by tapping on the inside of the sterile basin if needed. Using your dominant and sterile hand, grasp the pipe cleaners from the sterile field and use it to dry the inner cannula. Ensure that you are drying away from your sterile field and that no droplets fall onto it, breaking sterility. Dispose of your pipe cleaners. Inspect the inner cannula to be sure that it is very dry, and then with your non-dominant hand, remove the oxygen source and replace the inner cannula while locking it into place. Reassess your pulse oximetry. Using your non-dominant hand, remove the soiled, fenestrated dressing under the tracheostomy collar. Inspect it for drainage and dispose of appropriately. Using your dominant hand, clean the outer cannula and tracheostomy site with your sterile swabs moistened with normal saline from one of the basin containers you have not used yet. Clean from the stoma site outward, using only one swab for each swipe before discarding. Using your sterile gloved hand, use the 4x4 gauze to pat the skin and tracheostomy plate dry using a new 4x4 for each area. With your dominant hand, replace the fenestrated gauze dressing under the tracheostomy plate. This is not a sterile procedure, but should be done as sterilely as possible. Replace the oxygen device. Assess the ties or the tracheostomy tube holder for moisture or drainage. If needed, replace them. If using twill tape, insert one end of the tie through the faceplate eyelet and pull the ties behind the client's head around the neck to the second eyelet. Tie the ends in a double knot, leaving only enough space for 2 fingers under the ties. Decrease the oxygen and suction to prescribed levels. Provide mouth care if needed. Be sure to reassess the client's respiratory effort, lung sounds, airway, pulse oximetry, and overall status. Make sure to monitor for the return of baseline of your pulse oximetry and heart rate levels. Remove and dispose of all supplies appropriately. Make sure your patient is comfortable. Remove gloves and perform hand hygiene. Make sure your client is safe, placing any needed items within easy reach. Raise the side rails and lower the bed to the lowest position, and document all findings and report any abnormal outcomes.